Are eggs the culprit that increases cholesterol? How many eggs do medical guidelines recommend eating per day?
Hello, my name is Dom. Let's talk about this issue. Do eggs cause cholesterol? The culprit of elevation and medical guideline recommendations. How many eggs should you eat a day? More and more people are realizing that increased cholesterol levels in chickens increases atherosclerosis, risk of cardiovascular disease, and eggs, especially egg yolks, as a daily food, the one with the highest cholesterol content. It is believed by many that it will rise high cholesterol levels in the body. It even increases the risk of cardiovascular disease. Therefore, in life, some people choose not to eat or rarely eat eggs. Some people choose to eat eggs, but you have to melt the yolk. Actually, there is a misconception behind these behaviors. Cholesterol comes from two main sources: endogenous autosynthetic and exogenous food intake. In fact, human cholesterol, most of it is synthesized by the liver. Endogenous cholesterol, only a small proportion is obtained through food. Therefore, we cannot simply assume that elevated cholesterol is because eating eggs is a high cholesterol food. For example, medical observation has found that strict vegetarian, hardly any dietary cholesterol. However, their cholesterol levels are similar to those of people on a normal diet. It's about the same. Some of them, cholesterol levels rise, and atherosclerotic cardiovascular disease. These are endogenous cholesterol oversynthesis caused by. It has nothing to do with food cholesterol intake. Actually, different people respond to cholesterol in food can make a big difference. Under normal circumstances, most people eat through food. After ingesting more exogenous cholesterol, the synthesis of endogenous cholesterol in the body will automatically adjust. This increases total cholesterol. The level is normal, and about a quarter of them, after ingesting food cholesterol, insufficient downregulation of endogenous cholesterol synthesis. This can lead to an increase in total cholesterol. This kind of person, it's called dietary cholesterol hyperresponsiveness. It is also because of the existence of some dietary gallbladder, sterile hyperresponsiveness. So you can look at the population as a whole. Dietary cholesterol intake. It can still mildly affect the blood gallbladder, sterile level. So just to summarize, increased cholesterol levels in the body. Endogenous cholesterol metabolism is the main force. The impact of food cholesterol is secondary. Year 2020, published by the Chinese Society of Preventive Medicine, Healthy Lifestyle in China. Guidelines for the prevention of cardiovascular and metabolic diseases state that moderate control, intake of high cholesterol foods is enough. In this guide, the daily biomass of eggs, the recommendation given is adults eat 3 to 6 eggs per week. The reason why this is recommended is based on two pieces of medical evidence. The first, Chinese study of chronic pre-disease stickiness. This study, we've been surveying people for almost 9 years. The conclusion is that, compared to people who rarely eat eggs, people who eat an average of 5 eggs per week, it has a lower risk of cardiovascular disease. Second, Chinese atherosclerotic cardiovascular disease risk prediction research. This study was conducted in 15 provinces of China. Long-term follow-up of 100,000. This group of people ate an average of 3-6 eggs per week. All causes of death and cardiovascular disease risk is the lowest. In 2019, the American Heart Association also published a dietary cholesterol scientific advice on cardiovascular risk. The recommendations for healthy people are: eat up to 1 egg per day. To sum up, judging from the current medical recommendations at home and abroad, eat an egg on average for 1 to 2 days. This amount will not only make cholesterol levels are too affected, it can also reduce the risk of cardiovascular disease. Certainly, there is no need to be too rigid in your daily diet for those with high cholesterol levels or the internal organs in daily life. People who eat a lot of red meat, shrimp, and other foods the intake of eggs can be relatively reduced, and for normal cholesterol levels. For people with high protein requirements, the intake of eggs can also be increased appropriately. Even if you eat more eggs, there is no definitive medical evidence this increases the risk of cardiovascular disease. Okay, that's it for this issue. Follow AI Health, a good doctor at home. Put valuable medical knowledge, share with more friends.